Hi, I'm Shira.
And I'm Andrea, and we're graduate students at the University of Wyoming.
Today we're here to talk about childhood anxiety and what the process of seeking treatment might look like. While there are a number of different options, the treatment we'll be talking about today is called Coping Cat.
Coping Cat is a cognitive behavioral treatment that focuses on how anxiety is related to different thoughts, feelings, and behaviors. It helps kids develop tools and skills so that they can understand and overcome their anxious symptoms.
Now we'll show you a fictional example of what treatment with Coping Cat might look like. The story is fictional and all individuals are actors.
The story, all names, characters, and incidents portrayed in this production are fictitious. No identification with actual persons, places, buildings, and products is intended or should be inferred. We hope you enjoy this video.
I just can't do my homework anymore. What if I do it all wrong? What if I have to repeat 7th grade? What if I flunk out? So it snowed again today. What if the roads are bad when Dad's driving home? He might get in a car crash. What if he gets stuck? What if he gets lost? Mom and Dad were fighting yesterday. What if they get divorced? Who am I going to live with? What about my brother and sister? I just don't know what to do anymore. There are so many things that can go wrong.
Parents know their children better than anyone else, so it can be alarming when they notice changes in their child's behaviors and day-to-day functioning. Sometimes these worries are part of normal development, but other times they can be related to difficulties with anxiety. The types of behaviors a child experiences will vary depending on the child, his or her environment, and the nature of his or her trouble with anxiety. Although many children experience worries at some point in time, parents should be concerned when their children's worries become severe enough to interfere with daily life.
Have you noticed that Aiden's been really worried a lot lately? And for most of the semester, he has had a really hard time concentrating, and it's been rough for him.
And I've noticed his sleep has been pretty awful too. I feel like he hasn't had a good night's sleep in a while.
This just doesn't seem like Aiden. He said that he was so worried before the game on Saturday that his muscles hurt and he couldn't play. Now that I think about it, he hasn't seemed like himself for a few months, maybe since this summer.
You know, I have noticed that. Look, Mrs. Kennedy emailed me about Aiden's concentration in math class. They said that his work is fine when he sits down to do it, but he keeps getting up to ask if he's doing it right. Look.
When parents are concerned about the severity of their child's worries and anxious behaviors, it's helpful to find a professional who can provide an evidence-based assessment. This means that the tools and procedures that the professional uses have been supported by scientific research. An assessment will help parents to better understand their child's difficulty with anxiety and what to do moving forward. The path to assessment and also to treatment can look different for everyone. Parents can start their search by talking to their child's physician or school psychologist, but ultimately parents should look for a licensed mental health professional who can provide cognitive behavioral therapy, or CBT, for childhood anxiety. Parents should ask whether professionals trained in evidence-based approaches such as CBT and whether they are familiar with working with children. This may include doctoral level psychologists, school psychologists with doctoral or master's degrees, master's level social workers or licensed clinical social workers, licensed counselors, or marital family therapists. The website www.effectivechildtherapy.org offers information and resources that help parents to ensure that the professional who performs their child's assessment is trained in and uses methods that are supported by science and research. This professional can assess the nature and severity of a child's anxious behavior and can offer education and recommendations about what steps to take next.
I know you've had a lot of concerns about Aiden's behavior in the past few months, but together we'll figure out how to best understand what's going on and how to help Aiden.
Children may experience problems with anxiety in a number of different ways. Children may display nervous or anxious behaviors relating to many different situations. When a child worries excessively about a variety of topics, he or she may be experiencing symptoms of generalized anxiety disorder, or GAD. GAD can begin in childhood and adolescence and may last into adulthood. GAD is thought to be one of the more common anxiety disorders in children and adolescents. Estimates of the prevalence of GAD in these populations cover a wide range from 1 in 10 children to 1 in 100 children. Children with GAD tend to worry excessively about a range of topics, including performance in school, sports, social relationships, and natural disasters. They also experience 1 or more physical symptoms, such as restlessness, fatigue, difficulty concentrating, irritability, muscle tension, or trouble with sleep. Parents should understand that GAD can look different for different children. While some children will worry about the topics discussed here, others may experience worry and difficulty relating to other areas of their lives.
From what you've told me, it seems like Aiden's worrying and nervous behaviors are severe, and they are getting in the way of important things in his life. It also seems like he's been having this trouble for quite some time, at least 6 months. Is that correct? Well, based on what we've talked about, it seems that Aiden meets diagnostic criteria for generalized anxiety disorder.
Well, I guess now we know what's going on with him.
Is there anything we can do to help him?
There are a number of options available. There is some research that supports using medications like Zoloft to treat generalized anxiety disorder in children and adolescents. Since prescribing medications is out of my scope of practice, you would have to talk to a psychiatrist or to Aiden's physician about medications. What I can offer is therapy to address Aiden's difficulties with anxiety. Is that something you might be interested in?
I think so. If you think there's one that would work for Aiden, I think we'd be willing to give it a try.
Cognitive behavioral therapy has been very successful for children and adolescents like Aiden. There is also quite a bit of research that supports this approach to treating generalized anxiety disorder for kids his age. I believe that a cognitive behavior program called Coping Cat, which I have right here, would be a great option for Aiden. It was designed specifically for children and adolescents.
I had no idea that there were treatments just for kids. Do you think it will work for Aiden?
While I can't guarantee outcomes, I do know that research has supported Coping Cat's effectiveness for children and adolescents with generalized anxiety disorder. Actually, it has been effective in treating other types of anxiety, like separation anxiety and social anxiety disorder for kids his age.
Sounds promising. Let's give it a try.
Coping Cat is a cognitive behavioral treatment for anxiety in children. It is made up of 16 sessions and is designed to be easily accessible for children and their families. Coping Cat has been investigated within mental health research, and in fact, many well-designed studies have found Coping Cat to be an effective treatment for children and adolescents with GAD and other anxiety disorders. Tests of Coping Cat's effectiveness have found that approximately 60% of anxious children treated with Coping Cat alone recovered completely. As a result, Coping Cat is considered a well-established treatment for anxiety disorders in children and adolescents. With the help of engaging activities and a user-friendly workbook, Coping Cat guides children and their families through identifying emotions and learning coping skills. Coping Cat also helps children to monitor progress towards goals and allows them to practice applying coping skills and strategies. The first 8 sessions of Coping Cat are devoted to helping the child to understand and identify cognitive, emotional, and behavioral symptoms of anxiety. The clinician teaches the child about how a person's mind and body usually react to things that can cause anxiety, and they work together using worksheets and other exercises to identify what anxiety and other emotions look like for the child. In addition, these first 8 sessions can help the child to learn what can be done to reduce and cope with anxiety symptoms. Periodically during treatment, the clinician also meets with the child's parents. This provides a small break for the child, and it also allows the parents to ask any questions that they might have. During meetings with the parents, the therapist shares with them the skills and concepts that he or she has taught their child in individual sessions. That way, the parents are updated on the child's progress, and they can help the child to apply these skills at home. In the final 8 sessions of Coping Cat, the therapist helps the child to practice and apply the skills that were taught during earlier sessions. In these final sessions, the child and clinician practice identifying anxious thoughts and feelings and how to use coping strategies in situations that are actually anxiety-provoking for the child. Together, the clinician and child develop a hierarchy of situations that cause the child anxiety. Then, the clinician gradually exposes the child to those situations, first by asking them to imagine those situations, and later, the child and clinician may actually encounter low-stress situations together. Throughout these exposures, the clinician models, role-plays, and reinforces the child's use of coping strategies introduced in earlier sessions. With practice, the child should feel confident in his or her new skills. He or she will be able to apply them in new settings. Lastly, as a fun way to review therapeutic gains, the clinician records the child as he or she creates a mock advertisement describing his or her own success with Coping Cat.
That's
Good job.
awesome.
While Coping Cat is still a fairly new approach to treating anxiety in children, it has gained sufficient support in clinical trials to be considered empirically supported. However, if this approach to treating anxiety doesn't seem like a great fit for your child, there are a number of other options available. Studies suggest that for some children, recovery rates are stronger when Coping Cat is used in combination with certain types of medication. However, it is strongly recommended that parents consult a physician or psychiatrist to discuss medication options for their children or adolescents. In addition, it is often helpful to try psychotherapy before making considerations about medication. As parents explore their options for treating anxiety in their children and adolescents, it is important to consider interventions that have been supported by scientific research. Again, the website www.affectedchildtherapy.org provides a great deal of resources and information about different approaches to assessing and treating anxiety in children and adolescents. Even though anxiety disorders in children and adolescents can be concerning for parents, a great number of resources are available to help them find a solution that is well supported by scientific research.